Ever heard of a heart condition that kind of hides but shows this really unique ECG pattern? And it carries a pretty serious risk.
Ah, you must be talking about Brugada Syndrome.
Exactly. We're diving into that today. And you, our listener, probably want the key facts fast.
Right. Efficient knowledge.
So, our mission today, really get to grips with Brugada. What it is, the causes, how you spot it, and the management. Quick but thorough.
And you mentioned genetic links earlier, which is key. It often runs in families' autosomal dominant inheritance.
Okay, so let's define it properly. Brugada syndrome is.
It's a rare genetic disorder, fundamentally an electrical issue with the heart, characterized by that abnormal ECG we mentioned, and critically, an increased risk of life-threatening ventricular arrhythmias.
Which can lead to sudden cardiac death.
Precisely. That's the major concern.
So what's actually causing this electrical problem? What's going wrong?
It boils down to mutations in genes, specifically genes that code for cardiac ion channels. Think of them as gatekeepers for electrical flow in heart cells.
Ion channels,
Right.
like sodium channels.
Exactly. Sodium channels are the main players affected in Brugada. The mutations mess with how sodium ions flow, disrupting the heart's electrical stability. And research is still uncovering all the specific genetic culprits involved.
Interesting. And who is typically more at risk?
Well, having a family history is a big one. If someone in the family has Brugada or died suddenly without explanation, that raises suspicion.
Makes sense.
We also see it more often in men, and interestingly, in people of Southeast Asian descent.
Southeast Asian. Okay. Any, like, weird triggers?
Yes, actually. Fever. A high temperature can sometimes unmask the ECG pattern or even trigger the dangerous arrhythmias.
Wow, fever. That seems counterintuitive for a heart rhythm issue.
It is surprising, but it's a known phenomenon. It likely stresses those already vulnerable ion channels.
So pathophysiologically speaking, it's this faulty sodium ion flow, mainly in the right ventricle.
Correct. That impaired flow messes up the normal depolarization, the electrical activation of the right ventricle. That's what leads to the characteristic ECG changes, that ST elevation, and predisposes to arrhythmias.
You mentioned the SCN5A gene.
Yeah, that's the most well-known one, responsible for maybe 20–40% of cases. But it's important to remember there are many other genes and variants implicated too. It's not just one gene.
Gotcha. Now, if a doctor sees that ECG pattern, the ST elevation in V1 to V3, they don't just jump to Brugada, right? What else is on the differential list?
Absolutely not. You have to rule out other, sometimes more common causes of ST elevation, things like an acute MI, a heart attack.
Obviously.
Also, early repolarization syndrome, which is usually benign. Then there's arrhythmogenic right ventricular cardiomyopathy, ARVC, and even Wolff-Parkinson-White syndrome can sometimes mimic aspects.
So a careful workup is needed. How common is Brugada overall? What's the prevalence?
In the UK, the estimates vary a bit, maybe somewhere between 1 in 2,000 and 1 in 10,000 people.
So relatively rare.
Relatively rare, yes.
Huh?
But as we noted, it's significantly more common in Southeast Asian populations.
Clinically, how do people present? You said it can be hidden.
That's right. The majority are actually asymptomatic. They have no idea.
But when symptoms do occur,
They can be very serious. Syncope fainting spells is a major red flag. Or worse, cardiac arrest or sudden death. Often these events happen during rest or sleep.
during sleep, that's scary. And there aren't usually any, like, outward physical signs.
Generally, no. It's an electrical issue, not usually structural in a way you'd see easily.
Okay, so diagnosis relies heavily on investigations. What are the key tests?
The ECG is central, of course. We look for that specific pattern. A convex, sort of coved ST segment elevation, more than 2 millimeters in at least one of the right precordial leads, V1 to V3,
Followed by a negative T wave.
followed by a negative T wave, yes. And sometimes you see a partial right bundle branch block pattern too, but the ECG can be normal sometimes.
Ah, so it can come and go.
Exactly, which is why a crucial investigation is the drug challenge test. Using medications like flecainide or adrenaline, these are sodium channel blockers.
Which paradoxically unmask the condition.
Precisely. They stress the faulty channels and can provoke that characteristic ECG pattern if it wasn't obvious initially. This is often considered the investigation of choice when suspicion is high, but the baseline ECG is non-diagnostic.
And genetic testing.
Genetic testing is also important, yes, to identify the specific mutation, which can help with family screening and sometimes risk stratification.
Right. So once diagnosed, what's the management plan?
The cornerstone of management, especially for individuals who've already had a cardiac arrest or significant syncope, is the implantable cardioverter defibrillator, the ICD.
The safety net.
Exactly. It monitors the heart rhythm continuously and delivers a shock to terminate a life-threatening arrhythmia if one occurs.
What else? Lifestyle, medications.
Avoiding certain drugs is critical, particularly those sodium channel blockers we mentioned, but also some other medications. And managing fevers properly is advised.
And family screening is vital.
Absolutely crucial. Because it's inherited, first-degree relatives should be evaluated. Genetic counseling plays a big role here, too.
What about the long-term outlook? The prognosis?
It's variable. Really depends on whether someone is symptomatic, there's a specific ECG pattern, and if they have an ICD. But with appropriate management, especially ICD implantation in high-risk patients, the risk of sudden cardiac death is significantly reduced.
But ongoing monitoring is needed.
Lifelong follow-up is essential, yes.
And potential complications besides the obvious risk of sudden death.
Well, recurrent arrhythmias needing ICD shocks can happen. There's also the significant emotional and psychological burden for the patient and family, living with this risk, and potentially some limitations on certain activities or careers.
Okay, so wrapping this up, the key takeaway seems to be Brugada Syndrome, rare genetic electrical heart issue. Watch for that specific ECG pattern, risk of sudden death, especially at rest. Diagnosis needs careful workup, sometimes drug challenge. Management often involves an ICD and avoiding certain meds.
You've got it. It really underscores how these subtle genetic changes can have profound effects on heart rhythm and why awareness, even for rare conditions, is so important.
A sobering thought. The hidden dangers within our own genetic code.
Indeed. And just a quick note for anyone listening who might be preparing for the MSRA exam, if you need more high-yield revision resources like this, definitely check out pastthemsra.com.
And there's also freemra.com for free resources too. Worth a look.